Welcome back to the channel, everyone. You may have noticed I haven't been around for a while, so here's a question. How does a supposedly fit person just shy of 50 years old go from this and this to this in just 6 months? Well, I went to our local clinic because I thought I had an ear infection. They took my blood pressure and found it was 240/140, whereas normal range should be 120/80. They listened to my heart and heard a murmur. Then they did an EKG and saw an abnormality, and I was sent straight to the ER, do not pass go, do not collect $200. I waited there all night just to be sent home with an appointment for a cardiologist 3 months later. A few months and several tests after that, I was diagnosed with critical aortic stenosis and an aortic aneurysm. Basically, I would have been one of those people who just fell over and died with no warning, and everyone would have said how healthy I appeared to be. I had open heart surgery a few months ago, and then follow-up surgery last month because the incision became infected. Somehow, during the first surgery, my vocal cords were disturbed. This was very obvious on my last video, but gradually my voice has returned to normal. There's still more recovery needed, but the good news is that once I've returned to full strength, hiking itself should be no problem. And if anything, should be easier from a cardio standpoint because I'll be getting better delivery of oxygenated blood around the body. To avoid the need for future surgeries, I elected to get a mechanical valve, so I'll be on blood thinners, specifically warfarin or Coumadin, for the rest of my life. In light of that, I've put some thought into how my hiking will be affected and have come up with 7 changes I'll need to make. Those are the topic of this video. I'm not a doctor, so please don't take anything I say as medical advice, but maybe my thoughts will be helpful to anyone else who has had or will have a similar procedure and is wondering what the future looks like. Of course, I also welcome other thoughts and ideas in the comments below. So change number 1 is that I'll have to bring medication with me on each hike and remember to take it morning and evening. That'll be a couple of extra ounces, and hiking already has things that have to be remembered morning and evening, so that one shouldn't be a huge deal. Change number 2 is that my pain medication will have to switch to acetaminophen, also known as Tylenol, rather than ibuprofen, also known as Advil. This is because ibuprofen is an NSAID, which slows down blood clotting time. That's also what blood thinners do, so I don't want to needlessly thin my blood beyond what is prescribed for my valve. Acetaminophen isn't an anti-inflammatory, so it won't work as well for joint pain as ibuprofen, but it will work just as well for headaches, which is normally all I need painkillers for anyway. Change number 3 is I'll be bringing a couple of packets of blood clotting powder and some quick clot gauze and extra band-aids in my first aid kit. I did fall and gash my knee on a hike once, and anything like that would be much worse on blood thinners, so a way to speed up clotting will be needed. Hopefully I don't have to use them, but, better safe than sorry. Change number 4 is that I'll start wearing a medical bracelet. I already carry my Garmin InReach Mini, so I have a way to call for emergency help, but emergency personnel should know about life-affecting medications such as blood thinners, and that obviously applies to accidents in everyday life as well as on the trail. Change number 5, I'll have to take better care of myself out on trail. Previously, I've never been scared to bushwhack through thorns or risk a fall, scrambling around to get some good video footage. Now I'll have to take more care not to get cut or bruised, and probably act sooner to use band-aids or bandages rather than just letting cuts bleed. I don't want to let fear take control, but, rather just be a little more cautious. And I know my family at home will be more at ease with me being out on trail, knowing that I'm being careful. Change number 6 is that across the board, I feel colder now than I used to. That's a known side effect of blood thinners and beta blockers, and I have to manage it at home as well. I always used to sleep warm, but now I'll probably have to bring extra clothing or get a quilt with more insulation. Change number 7. And the last change I'll mention is diet. I'm still not quite sure how to handle this. Warfarin is counteracted by vitamin K, which makes blood coagulate faster. Foods rich in vitamin K are leafy greens, spinach, broccoli, kale, Brussels sprouts, and so on, which I eat a lot of when I'm home. That's fine because I'm consistent and the blood thinner dosage is set accordingly, but out on trail I don't have access to those vegetables. So now for some medical jargon. I have to get my blood tested regularly to determine my INR. INR stands for International Normalized Ratio, and it's the ratio of how long it takes someone's blood to clot who is on blood thinners compared to normal. Therapeutic range for my valve is 1.5 to 2.5, meaning my blood takes 1.5 to 2.5 times longer to clot than it does on average in normal healthy people who aren't on blood thinners. If I suddenly drop the foods rich in vitamin K that I normally eat, my INR could get too high and I risk dangerous bleeding from any injury on trail. So here's some things I could do. Option A. A couple of weeks prior to my hike, I could switch to my hiking diet. For example, couscous, ramen, energy bars, and tortillas, and get my blood tested and my dosage adjusted for that kind of diet. Then do the reverse when I get home. I'd have to try this plan without going on an actual hike to see if it would work, because I wouldn't want there to be unforeseen side effects while I was out on trail. The quantity of hiking foods that I would eat at home would also be significantly less than I would eat on trail, because I wouldn't be burning the calories by hiking. So even with this plan, I don't think I could get an accurate adjustment before leaving. Option B, I could freeze-dry green vegetables or buy freeze-dried green vegetables and take them with me as part of my diet in the approximate quantities that I eat at home. Freeze-dryers aren't cheap, and neither are freeze-dried vegetables. Green vegetables are great for gut health, but they aren't very calorie-dense, so they aren't the best hiking food. This is, however, a feasible option because the amount of vitamin K in all green vegetables is well known. Option C, I could buy a test kit, take it with me, and adjust my own dosage on trail. This is 100% not recommended by the medical profession, but whenever they adjust it, it seems like they just do some elementary maths combined with guesswork that I could do myself. I imagine there must be diabetics who hike with test kits and adjust insulin while they hike. Still, I'm not sure about taking my life into my own hands like this. Option D, I could calculate exactly how much vitamin K I'm consuming on a daily basis at home by weighing all of my vegetables, and then take a vitamin K supplement of the same amount out on trail. Vitamin K quantities for vegetables are known, so this is feasible, but again, not what the medical profession recommends. I'd have to try it at home and get tested regularly to see if I could maintain a stable INR using this method, but it does seem doable. So both of the options that seem most likely involve keeping my vitamin K intake constant to match my medication dosage, rather than changing my diet or medication. The good news is that for my valve, it's better to have my blood too thin rather than too thick, so underdosing on vitamin K or foods rich in it is better than overdosing. Once I've done a hike, I'll follow up with a video on what option I chose and how it went, should I live to tell the tale. So all in all, these are the changes I can foresee in my hiking future, along with a few uncertainties. What do you guys think? If you have any other ideas, please feel free to drop them in the comments below. As always, if this content is valuable at all, please give this video a like and whack those subscribe and notification buttons. I'll see you on the next one.